Chairman Wyden, Ranking Member Crapo, and members of this committee. My name is Steffany Stern, and I'm the Vice President of Advocacy for the National Multiple Sclerosis Society. I joined the society as a staff member 7 years ago, but I've been part of the MS community since I was a year old in 1981 when my mom was diagnosed with MS. Until 1993, there were no treatment options for MS. All my mom could do was try to take care of herself and hope that her relapses didn't take away too much from her life. While we now have effective treatments, people with MS and their families, like my parents, struggle with their price. My parents moved to a smaller house, replaced their cars with less expensive options, and have cut every possible corner to make ends meet. My dad is 69 years old, and he has his own health challenges, and he has had to get a job driving a city bus in town just to pay the bills. Without the charitable assistance that they receive, they could not pay the $2,400 they owe for her medication month after month. It just seems wrong to us that people with healthcare coverage still need charitable assistance. And my parents aren't alone. It is extraordinarily personal to publicly share one's personal financial and health challenges, but person after person has given me permission to do so because they want you to understand and to change the status quo. And I sit here in front of you representing all of them. The first most troubling fact that I want to share with you is that 40% of people with MS surveyed by the MS Society alter the use of their disease-modifying therapies, which we call DMTs, due to cost, including stopping, skipping, or delaying their treatment. For example, Lori Lee from Oregon changed her MS medication twice after joining Medicare because the price would have bankrupted her and her husband. During these changes, Lori's MS symptoms increased substantially, and she transitioned from the relapsing form of MS to the progressive form of the disease. Therese Humphrey Ball in Indiana was forced to change DMTs after her costs soared to $6,000 a month. But the next DMT she went on didn't work for Therese. Her MS progressed, bringing lingering cognitive issues among other problems. And Bob Miller in Minnesota made the difficult decision to stop taking his MS drug altogether because he didn't want to financially devastate his family, even though he has Medicare. These kinds of choices are terrifying for people with MS. Any gap in their medication could mean disease progression, and that could mean a permanent loss of mobility or cognitive function. A significant percentage of people with MS report stress or emotional impact, and they make lifestyle sacrifices to afford their DMT. Medicare out-of-pocket medication expenses for Lisa McRipley in Michigan average a debilitating $9,000 a year. She often uses her charge cards to cover the costs and relies on her family to pay for food and other expenses. Wayne Harbin in South Carolina has to take $13,000 out of his 401k every year to cover his share of Medicare costs. I could be here all day telling these stories. Early and ongoing treatment with a DMT is the best way to manage MS and prevent the accumulation of disability. More than 20 MS DMTs have transformed the treatment of MS over the last 29 years. Or more accurately, they have transformed the treatment for those who can afford it. We call on this committee to bring forth legislation to enact a Medicare out-of-pocket cap and smoothing mechanism to spread patients' costs throughout the year. But just those policies aren't enough. That first medication my mom took in the mid-1990s was priced at $11,000. Today, the price of that same DMT is over $111,000. Her current medication has a list price of nearly $104,000 per year. This medication's price has increased 5.7% in the last year and 35% over the last 5 years. In February 2022, the median annual price of brand MS DMTs was close to $94,000, an increase of nearly $34,000 in less than 10 years. 6 of the MS DMTs have increased in price more than 200% since they came on market. 9 are now priced over $100,000. Medications on the market for more than 20 years still have annual price increases. Patients not only pay more out of pocket, but more in premiums for their drug coverage due to the cost of their medications. The current system is not working in the best interest of people with MS and other chronic conditions. It is unconscionable that in 2022, people with MS and other health conditions who cannot pay for their medications would be in the same position my mom was in the 1980s with no treatment option. We strongly believe that Medicare negotiation and inflationary rebates, along with out-of-pocket caps, strike that right balance between creating affordability and maintaining incentives for manufacturers to innovate. We look forward to working with this committee as you work to address the high price of medications. Thank you.
Ms. Stern, let me go to you because I thought all night, I've been doing this since my days as director of the Gray Panthers, and I can't recall a situation more infuriating than hearing your mom basically describe how you all have to beg charities to give you some extra help so she can pay her share of the $111,000 price tag that the manufacturer charges for the drug. So you say to yourself, it's the company that escalates the prices way beyond what the rest of the world is paying, but then they're going to say to you and your mom, you guys got to beg, and she describes the situation where if she doesn't get the begging going at the right time, then things go by the boards, and her husband's driving a bus. I mean, what in hell is going on here? This is not a debate of a technical issue. Something's way out of whack when people like your mom are begging for a little bit of help, which really is a lifeline for us. Tell the committee exactly how this works and how, here you are, you're a professional in the field, and you're helping your mom. And I ran a legal aid program for the elderly in Gray Panther so I could help people. What are people going to do here other than just beg and beg and beg to be able to get a life-saving drug? Or at some point, I guess people just give up and pass.
Yes. So yes, it is a terrible situation. It's very common for people with MS, like my mom, to have to rely on some kind of financial assistance to afford their costs. Our studies show around 70% of people rely on financial assistance just so they can pay their out-of-pocket. But a lot of people are shocked when they transition to Medicare and they find they can't get assistance from the drug companies anymore. They have to rely on these charitable funds. And the charitable funds are so hard to get into. They run out of money all the time. Last year, they only opened 4 times for a total of 25 days. So you can call and call and call and still not get the help you need. And we have a lot of stories from people like Ms. Dixon in Ohio in my testimony, people who can't navigate the process and go off of their meds. It is a very draining process, and people with MS have a lot of fatigue, cognitive challenges. It's just unbelievable to have this system where people who have health coverage still have to chase down that financial help to afford their life-changing medication. And just like you said, my mom describes it as just begging every year.
So a simple question, Ms. Stern, and thank you so much for being here and representing people who really need a voice in this discussion. You said the first MS drug your mom used costs $100,000 more today than it did 30 years ago. Does the drug work any better today than it did 30 years ago?
No, it's my understanding that it's the same medication. I have heard they have made small tweaks to the injector, making it, like an auto pen, but no, it's the same medication.
Mr. Chairman, thanks very much for this hearing, and I want to thank our witnesses. I'll start with Ms. Stern, and then I'll have a question as well for Dr. Conti. But Ms. Stern, I wanted to start with you and start with gratitude for your willingness to testify and share your mother's story and the stories of so many other MS patients. I think you spoke for a lot of families across the nation with your testimony and your appearance today. When you combine so many costs in the lives of families that are very high with the cost of prescription drugs, it's like a bag of rocks on someone's shoulder every day on that individual and their family. And we've got, obviously, it isn't simply prescription drugs. We've got other heavy costs that people carry around. The cost of care is a big one that we don't talk about enough. The cost of child care, which is just crushing families and literally preventing them from getting back to work, and we haven't done nearly enough about that. The cost for care of an older adult, a family member, or the cost of care for people with disabilities. So you've got all these bags of rocks on the shoulders of so many families, all at the same time, weighing people down every day. And if you have Medicare, it prevents you from making the kind of choices you'd like to make about how to spend the dollars you have. On page 4 of your testimony, Ms. Stern, you list 8 areas that people make sacrifices to more easily afford prescription medications, including postponing paying other bills they have, or postponing retirement itself, or spending less on their family. So if Congress passes reforms to cap out-of-pocket costs, what type of financial relief would that bring for people with Medicare?
Thank you so much, Senator. It's such an important question. An out-of-pocket cap would be nothing short of life-changing for the MS community. I hear day in and day out from people with MS, like my mom, that they cannot afford their costs. Our most recent study showed people are paying an average of $7,000 a year just for their disease-modifying therapy. They're paying, even once they get to the catastrophic phase, they're paying $352 a month. Those numbers are so high, even people working really good jobs would struggle to pay that kind of burden. And people who are seniors or on a fixed income, people with chronic health conditions and disabilities, they find those costs insurmountable. So we do have people making all kinds of really difficult decisions to, put not paying their bills, postponing retirement, putting their groceries on their credit cards. I don't believe that our intent was ever for seniors with health conditions to choose between taking their meds and paying other bills. That's just the unfortunate outcome. So yes, it would be a huge step for the MS community and so many other patient communities to address out-of-pocket costs.
Thank you very much. Ms. Stern, first of all, I just want to thank you for your very moving testimony, and thank you for being here. Several Granite Staters who have multiple sclerosis recently visited my office to share the financial toll of high drug prices on their families. According to the National Multiple Sclerosis Society, the median price of certain medications for MS is close to $94,000 per year, an increase of almost $25,000 since 2015. These Granite Staters also discussed the strain of worrying about how they'll afford to fill their next prescription. So, Ms. Stern, how do high drug prices exacerbate the stress of managing a chronic condition like yours?
That's a great question. First of all, I should point out that these high prices really do translate to real-life impact for people with MS. People who are relying on Medicare are paying a co-insurance for their MS disease-modifying therapy, so they're paying, 25% or whatever percent of the cost of that drug, and that can be a huge amount of money. MS is a condition that is exacerbated by stress, like so many other conditions. Having to navigate the system through MS symptoms such as chronic fatigue and sometimes cognitive issues, it can be it represents a huge burden for the person with MS, for their family, for their support system.
Thank you, and let me say, Ms. Stern, thank you for being here. Thank you. I have a cousin who's a year younger than I am with MS, and he is in a wheelchair. And the worst thing that I can see is not only how my aunt and he have to manage the cost for their drugs with everything else that they have to do, food on the table and pay their bills and a roof over their head. But here's the other thing. Can you talk about the anxiety that comes with worrying about prescription drug costs and what toll that takes on a patient who is really having challenges already with their health? What kind of impact does it have on their mental health?
Yes. So, I would say these are excruciating decisions, right? These are impossible. And I said in my testimony, I think it's one of the most compelling findings we've had in the last decade, 40% of the people with MS are altering the use of their medication. So they're making those choices, depending on what they're being charged for their med and what money they have. So they might be skipping doses. They might be going off their med altogether. And with that, you worry about what's going to happen to my disease. Is my MS going to progress? Am I going to lose mobility or cognition or something like that? And will it ever come back? So, it's anxiety that really compounds the difficulty, as you said, of living with a disease that's already a challenge.
Thank you, Dr. Conti. I think that the data are clear on this. Brand name drug prices are rising, not falling, and it is absurd to claim otherwise. So let's go to their second argument. Next, pharma claimed that their price increases weren't really hurting consumers at the pharmacy counter. Ms. Stern, you represent patients who are forced to pay high drug prices. What do you make of pharma's argument that increases in list prices don't actually hurt consumers?
I would say right off the bat that does not reflect the lived experiences of people with MS and seniors and people with chronic health conditions across the country who are telling us that they cannot afford their drugs, that they are going off of their drugs, they're skipping doses. And we do hear, I think I've shown that the MS medications have gone up exponentially and that the patients are paying a percentage of that cost and their coinsurance. But it's not just our medications. A lot of medications are going up dramatically. And it's like you said, you can, kind of cherry pick those statistics, but that doesn't mean that people aren't faced with the choice of, buying their groceries or taking their medication.